Hi, welcome. Letting everyone get in and get settled. Okay, perfect. Hi, everyone. Let's make sure you're in the right webinar. This one is on health services, so professional development for health services. And I'm Christina Ellis. I'm the director of the Academy at NHSA. And today I'm going to be your host, walking through all things health services professional development. This truly is the most exciting Zoom webinar for me because my background is in health services. Before coming here to NHSA, I worked at a program in Tulsa, Oklahoma called CAP Tulsa for about 12 years, where I oversaw the health services and, in true Head Start fashion, nutrition services, food services, collaborative services, quality assurance there for a little bit, and all other things wrapped into that. And I left right in the middle of the pandemic. I don't blame the pandemic on leaving health services, but I'm so glad all of you are still here, are new being here even after being a part of health services during a pandemic. We have some really great content for you today, so let me share my agenda with everyone. Okay, let's go back a slide first. We like to start with our vision and mission anytime that we are doing a presentation at NHSA to really sort of ground why we're here, especially if you're new to Head Start and you might not be familiar with the National Head Start Association. So what we want to do is we want to lead to be that untiring voice that will not be quiet until every child is served with the Head Start model of support. And whenever I think of the Head Start model of support, and that word model, I do think of health services because that's something that makes us so unique, is the comprehensive services that we provide children and families. And I definitely think health is a big part of that. And then also to advocate. So we are advocating for funding, we are advocating for resources, for professional development, and also providing things like PD, like we're doing today. And then our mission, like I said, this one powerful united voice. We are you, you are us. We're here to serve the Head Start community. That's all that we do. And then we're this collegial, collaborative Head Start filled nonpartisan support of increased federal funding. And then healthier, empowered children and families. And again, I think about what you do as health managers, health staff support, family advocates. That's what you're doing, is to, at the end of the day, make sure we have healthier children. So here is our agenda. I'm going to go a little bit over the Academy at NHSA so you have an understanding of our professional development that we have. And then I'm going to go specifically into our health services professional development. And then the larger portion of the conversation today is going to be the three other ladies that we have on our call today, Jackie, Adrienne, and Renee, and they're going to tell you about their experience as health managers, health administrators, health staff, and the courses that they've taken to help along the way in fulfilling their commitments to their community and their programs. And then we're going to make sure we have plenty of time for Q&A as well. But before we get into that, we have some polls here. And so you're going to see some polls come up. And if you can just take a little bit to tell us about yourself and who's in the room, we want to make sure we're addressing your needs. And so you're going to see that coming up here real quick. And Courtney, let me know. Oh, there it is. The first thing that we want to know is, what is your role? Earlier, I said in Head Start, we like to have a little bit of everything, right? Is a little bit of health, a little bit of nutrition, maybe you have some food service. So tell us here what your role is. Okay, great. We've got a couple of people. Looks like we've got about half of everyone who has entered in. If we can just get a couple more in. Again, this is, what is your role? Okay. So it looks like 80%, which is good to know, is a health manager or health staff. But we also have from family service managers, and then other. If you don't mind putting in the chat what your other is. And so again, if you put other, if you don't mind popping that in chat and telling us what your other is. And then now we're going to go ahead and go to our second one. Courtney, if you can pull that up.
They're coming, sorry.
That's all right. And so, Courtney, on my screen, it still says the what is your role?
There it is.
Okay, and this one is how long have you been in your role? Okay, so this is coming in. Our options are less than 6 months, 6 to 12 months, 1 to 3 years, 4 to 5 years, and then more than 5 years. Okay, let me go ahead and share those results. Looks like we have 1 to 3 years as the majority, but we do have a couple of people who have been here less than a year. And fantastic, we have some who've been here more than 5 years. And so I'm sure they have a lot that they could be sharing with us as well, which is also a part of why we do these webinars, is networking, is being able to talk to people who have been in this role for more than 3 years. I know, though, you learn a lot in the first 3 years, but to be able to network with them, ask them questions, be able to reach out to our presenters today and ask them questions as well. So I'm going to go ahead and stop sharing this and talk to you a little bit more about the Academy at NHSA before we let our presenters talk. Okay, so what we have here is we have stackable learning. And so this is for members as well as non-members of NHSA. And if you have a question on if you're a member, you could probably go to your administrator or your director, but you can also reach out to me and I can look it up to see if you're a member as well. But we have courses that are in these buckets of basic, essentials, and then we have credentials and certifications. So your basic courses are going to be health for everyone. So for example, it's important for everyone in your program to, let's say, know about bloodborne pathogens or to have CPR and first aid, right? That's for everyone. And then we start getting a little bit more specialized, and maybe it is for your staff in your program who are really making the decisions about the health and safety policies in your program. It's at that level you're really looking at these essential courses. And then let's say that you've been in the program for several years and you're ready to highlight what you know. You've been in your program 3+ years and you're ready to say, I know this, actually, I can create a portfolio about all of the things that I have learned being a health manager. And that's really when we get into the certification space. And I'll let you sort of read through this picture here to be able to know more about what's included, if it's online, if it's live, and then the how many weeks it would take to complete it, because I know that's important. All of you are busy. And let me go ahead and go to this next one to show you what courses that we have. So what I did on this is I bolded any of the courses that we have right now that would be pretty specific to health. There's a lot of courses on there that's good for any person who works at Head Start, like Head Start History, Head Start Basics. But then there's going to be a couple of our courses that are going to be important specifically for health managers, because you have this big responsibility. Just today, one of our speakers was like, I've got a sick kid, I've got to take care of that. And then 5 minutes later, she said, and by the way, we are in a tornado warning a couple of miles away. And so you've got to make sure that everything's ready for the building and that everyone is safe and that you've practiced all of these drills. And that is the life of a health manager every day. And so these courses are going to help you get into that space, whether you're the person in the classroom as a teacher who has to deal when the child first gets sick in your classroom to the health manager who has to provide the support and policy making for that, all the way up to the administrator as well, who's supporting all levels. And so we have things like gardening with kids, health services essentials. If you are a health manager, you are also a manager in general. And being a Head Start specific manager is something very unique in the world of early childcare. So we also have a course that is for Head Start managers. And then special education, nutrition, health policies, child abuse, active supervision, all of these things are sprinkled throughout our jobs in the health community. And this right here is a barcode where QR code where you can take a snap picture real quick, because you might say, I'm interested in learning about these right now. And I know you're going to be tempted to go straight to the website and look at it, but we still have a lot of really great information to share over the next couple of minutes. But still, go ahead, take a picture of it on your phone, and then these specific courses are going to pop up, and maybe you can take a look at them as they're talking about these courses. The other thing that I think is important, especially for health managers, is to make sure that you have documentation of these courses. For some of your certifications, some of you might be a CRN, a nurse practitioner, and you need to have documentation of the courses that you have taken for like your CEUs and other educational credits. All of the courses here at the Academy, they're going to have a digitalized space for you to put all of your credentials along with a transcript. And so a course that you take at the Academy is going to have this information as well. And I was going to pull this up really quick to give you an idea of what that looks like. So here is, I used Dr. B's, I hope she doesn't mind. So here is Dr. Bergeron's transcript, and then you would be able to see where all of your certificates live from NHSA. And it is taking a while for them to load, but this one, the National Head Start membership one, has loaded. And if you are a member, you already have access to this digital badge, and you just need to go in and activate it, and you would be able to see your badges already in there for any course that you've taken at NHSA. But also you can put in other courses as well, and it follows you as a person, not your program. And so you can take it anywhere in your life that you go, and you'll be able to use this. Okay, so let me go ahead and go back to my presentation here. I'm going to stop share and then pull it back up in another screen. Okay. All right. And now I'm going to turn it over to our presenters today. First up is going to be Jackie Rivera. She has been a fantastic instructor and reviewer for our courses, and she's going to tell you a little bit more about what we do. And then she's going to turn it over to Renee and Adrian, who are health managers out in the field as well. And they're going to tell you a little bit about their experience with professional development in our space.
Christina, we can only see your pink screen.
Well, that's not going to work. Let's go ahead and share the right screen then. Okay, is that working now?
Yes, Health Essentials.
Okay, perfect. And so Jackie, if you don't mind, go ahead and introducing yourself and take it over from here. Oh, you're on mute, Jackie.
How many times do you think I've done that in the last 4 or 3 years? I am so excited to be here and talk about our different courses with health. My name is Jackie Rivera, and I have been a health administrator for a little over 12 years. at a community action Head Start in Central Missouri. Before I became a nurse, I actually was in the classroom for 11 years teaching private preschool in Illinois. And when my kids went to college, I decided I was going to try something new. So I went to nursing school. And then this position came up with Head Start. And I thought, this is perfect. Kids, health, blend, love it. I was once told when I was hired, if you make it a year, you'll stay forever in Head Start. And I think I'm a forever girl. But I'm so pleased to talk to other health managers. With teachers, there's a whole bunch of teachers, and with family workers, there's a whole bunch of family workers. And it seems like health, there's usually only a couple of us. So I'm so glad to spend some time with my health family. So the first class I want to talk about is the Health Essentials. And this is a great course, not just for those that are new to their positions in health, but even for those that have been in it for quite a while. And when Renee speaks, I think she's going to share that with you. She had been in her position for a long time before taking this course, and she was talking about the new information she learned. So this one is basically for everybody. This one can be done, I believe you get 12 credit hours on this one. But the feedback I get is most people say that they can get this done if they devote a whole day to it, the whole day, maybe part of the next day. They give you some excellent resources to bookmark as you go through. Sorry. That's okay. And it really talks a little, or it really is based on the performance standards and why do we do what we do? I mean, how many of you started in here, and I put a little note here, started and all of a sudden you get your health position and somebody in the program says, oh, well, I got an IM yesterday. We're going to discuss it at the PC council, but maybe at the HASAC meeting, but I got some information on eClick about PIR. And you're going, what are you talking about? So a lot of the health acronyms and Head Start acronyms are in here. We talk about physical health, oral health, mental health. There's a section on a little bit on HIPAA, nutrition, disabilities, staff wellness, ideas for staff wellness. So this is like a big picture of what health is in Head Start. And like Christina said, you can be nutrition and mental health, or you could be safety and compliance. We all kind of fall under that health umbrella. So this is really good for family workers that are doing health, obviously the health team, those in management, those who supervise people that are doing health. This benefits quite a few positions in Head Start. But it has activities, videos, and then some assignments at the end. And this also gives you 2 hours of support each month. You do have 30 days to complete this. And we meet at the very beginning via Zoom, and we talk about it and make sure that you're on track. And then we meet at the again to talk about some of the things you've learned and to share ideas and things for the future. So that is Health Essentials. Now, our next one is the health certification. And health certification, this one is more work. This one you actually get 4 months to complete. And this is kind of like a portfolio on what you know about health in your program. It's not a certification for your program, like, when you get NACE certified. This is for you and follows you. And this talks about, some of the things it talks about is the Head Start history, mission, and philosophy, general knowledge of Head Start programming, including the performance standards, monitoring, policies, procedures, implementing a health and development service program, health and safety practices, comprehensive nutrition programs, mental health services, parent involvement in health services, and staff wellness. A lot on this one, you can tell, that's why you get 4 months. The involvement of the HASAC and advisory committee, parent committees, and professional ethics and development. So this is divided into competencies and functions and activities. And you write a narrative. A lot of it is narrative in your own words, but there's other things such as attaching things or creating things, or possibly we have something where you interview a medical professional on ethics. So it's got quite a variety of activities. This also, we meet twice a month. And what I tried to do after orientation is not only answer questions about the certification, but I try and go through the actual activities with you. We read them, we discuss them, we come up with ideas which could be included for your submission. And then these are actually graded as you complete them, which is really nice, because if you're maybe on the wrong track or whatever, I can email you and hey, I would try this or do this different. You also have access to email me at any time. So I'm totally open to questions, or hey, can you just take a look at this one and make sure I'm on the right track, or could you explain this one to me a little bit better? So what I really love about this is you have 4 months of support while you're doing this. And I think that's wonderful, because a lot of certificates, they basically say, here you go. We're going to let you know in a couple of months whether you passed or not. This one just gives you a really great opportunity to learn new things, and also to learn from other people getting their certificates at the same time.
Thank you so much, Jackie. Are we ready for our first learner today?
Yes.
All right. Do you mind making an introduction?
I think we're first going to talk to Miss Adrian. Adrian was in a group. They had 10 people from their program get their health certifications at the same time, 10 all at once from Atlanta. I think I remember Adrian. And Adrian was, I'd say she was one of the star students. She did a great job. So that's why we invited Adrian to share her experience with us today. Take it over, Adrian.
Well, good afternoon, everyone. My name is Adrian Etheridge Holden. I am the Health Service Manager for the YMCA of Metro Atlanta Early Learning Program. And our program is funded to serve 2,254 children. So we have a pretty large program, and we cover counties, Fulton County, DeKalb, Morgan, Greene, Barrow, and Elbert counties. And we have a total of 5 health specialists that cover those locations as well. And I began my position in 2021 during the pandemic, as I heard us speaking about that earlier. And a year later, we started the health credential. So just imagine that. So I was a brand new manager, but I had sat in the seat as a health specialist for 8 years. So I was very familiar with health services, but looking totally different as a health manager now, because going through the certification, it gave me the opportunity to now kind of tweak the things we're already doing and just enhance them to be a lot greater than what we're currently doing. And just going every week to Jackie held our hand. She did. Because this was a serious feat for us. It was. And only because we had the disabilities as well as health completing this at the same time. And with health going through, we were able to answer the questions, but we did need someone to kind of walk us through, because you can't say the same thing. So even though it's your program, you cannot, everyone, carbon copy and put the same answer down. You have to put it in your own words. So we did meet together and we did discuss it, but they had to put it in their own words. And also with disabilities and mental health being a part, there are 2 competencies that disabilities and mental health had to answer. So at that point, health was listening to disabilities and mental health, and they had to walk us through. So it was a team effort, and we made it through. Yay, team. But I am telling you, you cannot do this at the last minute. You have to go through it. You have to make certain, utilize your lesson plans, your policies and procedures and your work plans. Utilize those. Those are the main tools that will help you operationally to see what it is specifically that you're doing. Thank you. You're on mute, Jackie.
Jackie, one more time on mute.
Uh, Our next speaker is Ms. Renee, who just recently completed the Health Essentials course. And she was actually one of the first people to take the course. So thank you for that, Renee. You helped us tweak it. But Renee, if you could share with us your experience of taking the Health Essentials course and maybe a little background on yourself first.
Okay. I've been at Floyd County Head Start for 8 years. I started in the kitchen, so as they say, everything kind of works together. We were a really small Head Start at that time, and so we grew from there to we incorporated early Head Start as well. So we've grown in that meantime. But once I was in the kitchen for a year, the health assistant position opened up, and I had worked in the health offices around doctors' offices in Georgia, as a matter of fact, Adrian. And so I just took that position, and I've been in this position for 7 years. But during the pandemic and everything, I wound up going back to being the kitchen supervisor interim. So that was quite a task as well during all that pandemic and trying to get all that straightened up. But I've been doing it for 8 years. But when this course came up and my manager said, we're going to take this course and you're going to be the first one to take it. There's 4 others. She wants to take it, and there's 3 other assistants. And she's like, I want you to take it. And it was quite when I first started, because I've never done Canvas, I've not done anything like that. So that was quite intimidating when I first started. And Jackie was like, you can get this. And we worked it through. But it was very informative. It definitely helped me with understanding the PIR and all of that, and just how it all combines together and how important it is that what we do, not just, fixing up the kids when they're sick or whatever, but all the other elements that's included in the health services. So did you want me to talk about the reason why, Jackie, in my bio? Okay. So my short story is when my daughter was born, I had a small EA or Head Start in our little county, in another county, and her great aunt was actually a teacher there, and she just begged me to put her in that Head Start class, and I was like, no. You ask too many questions. You want too much. You want to tell me how bad, what I'm not doing right, not getting my well checks, not getting my shots on time. I was like, no, I don't want to do it. So I didn't put her in it. Then when I got started, when I worked in the kitchen, I started getting the basics of it because I was just doing kitchen work. So I didn't really understand Head Start. And then once I started understanding why Head Start and I started doing the health, now I'm like the huge advocate for it. I'm like, but I see it on their part, on the parent side, as to why we ask those questions and want to get this done. And so it definitely changed my whole perspective on helping the parents to understand why it's important to get those things done.
Thank you, Renee. I really appreciate that. And I'm glad that you came around to the Head Start way. But like you said, you have something now where you have an understanding of families that come through, or families who say that's not for me. I have a similar story. I have a sister who I would always say, you should go to Head Start, you should go to Head Start. And it's the same thing, that fear of being in my business. And I think health is one of those things that even go sort of beyond that, of now you're wanting to know about the health of my child and what that means, and not understanding the sort of full comprehensive, whenever we say it is this Head Start model and what do we mean about comprehensive services, that could be a little overwhelming. I do have some questions that I want to ask our speakers today, but while I am asking those questions, if you guys can pop your questions into the chat. The other thing is, you might have missed this earlier whenever I was doing the polls. there is a question about where do you receive your professional development right now? And so whenever you started your position, how did you learn about Head Start Health and comprehensive services? And so if you can also put that in there. So while I'm asking some follow-up questions, if you can answer where you currently getting your health training from, and then also any questions that you have for us, and then Courtney's going to keep an eye out for that. But my first question is for Jackie. And Jackie, as an instructor, where do you see health managers struggling the most? Not only with the course, and this actually might go in hand, but just in general with their role, where are you seeing folks struggle?
Oh boy, struggling a lot with staff turnover. So I know when we do new hire, it breaks my heart. I'll have 10 people in new hire and I'll spend hours training them, and then all of a sudden, you know, a couple months later, they're gone, and that's kind of sad. Actually, hiring people is a struggle right now. God, there's a lot of struggles. Getting parents to take their kids back into the doctor after the pandemic and realizing that it's safe, and catching up on those immunizations that people were putting off. And kind of like I mentioned, there's just a few of us at every program. So I think finding a community of other health professionals to talk to and bounce ideas off of. And, you know, often we think we have to, you know, create the wheel all by ourselves. And if we can just, you know, reach out to others that are doing the same thing, they'll come up with the answers. And you're like, oh my gosh, why didn't I, you know, think about that? So I think that's some of the struggles I see right now.
Perfect. Thank you for sharing that. One more question for you, Jackie, is what tips do you have for people? So there might be some people on the call today who have looked at the health courses, health essentials, health certifications, and maybe they're a little intimidated, or maybe they're new to Head Start and they don't know if this is a course for them. What tips would you have for them?
Well, I would say if you're pretty brand new to Head Start, start with the health essentials and then move on to the next one. So I would start with that one if you're in the newer category. And I would say, you know what, time management is key to getting the health certification done. And I see Adrienne shaking her head. You've got 12 competencies to do 4 months. So if you can get 3 done a month, you are in really good shape. And when I'm grading those, I see that people that actually spread these out and have good time management are so much more likely to pass than people that waited until, you know, the last couple of weeks and then they're rushing trying to get it done.
Perfect. Thank you for sharing that. Now, this one is for Adrienne and Renee, and this is just about being a member of the health staff team in general. And that is, what tips do you have for the new managers that are here, the ones who are 0 to 1 year or really even under 3 years? What tips do you have for them? What have you experienced in your time as managers?
Renee, would you like to go first?
No, you can.
Okay, all right. For myself, let me think about that. When you're thinking about tips, going back to something Jackie just said, I mean, you have to be organized. You have to be organized as a health manager because you're kind of managing the entire program. And if you have a program of our size, you have to have some type of layout. I have calendars, I have planners, I have notepads, I have whatever, because as soon as you walk into the centers, it's something going on all the time. So you have to learn to manage your time, and also stay abreast of what's going on within your centers through your health team. Just stay abreast, you know, have weekly conversations, or it doesn't have to be a real formal meeting, but just meet so you'll know what's going on. With tips, and just going further with your question, Christina, with tips with the health credentialing as well, develop a game plan. Because if everything else is going on as a health manager, and now you're incorporating completing the health competency, you will not succeed if you do not develop a game plan, because life will happen. Children will get sick. A pandemic may erupt in the middle of going on. So you just have to have some type of plan.
What
Adrian,
size is
what
up?
size is your program?
Our program, as I mentioned, we serve 2,254. We have, we're funded because right now, because of COVID, we have not been able to, all the children to return back, but we're funded for 2,254 children. And that's all across about 5 or 6 counties. So it's a nice size.
Yeah, and how many health managers do you have?
Right now, we have 5.
Okay.
5.
And so there's, if I could make 2 comments
Yes,
about
ma'am.
what you shared, Adrian, is one, you were talking about the importance of collaboration and talking to people and knowing about what's going on in the classroom. And my first couple of years overseeing the health program, I remember one of the health staff, we were talking about the difficulty of getting a parent to go get their well child check, or really turning in any of the documentation that we have. And she goes, I always start with the family advocate notes. We use Child Plus. And it was like, what do you mean you start with, you go into their screen, because we health managers and family advocates were separate people, right?
Okay.
And she's like, well, I go into their screen and I look at their notes. And if mom right now is struggling because her car broke down, and I'm all like, where's your well check? Where's your well child check? That's not the priority. So how can I work with that family advocate and that parent? They probably can't go get their well child check because they don't have a car. And there's this sort of vicious cycle of dumping all of these things on this family. And then that sort of opened up the lines of, what else am I missing on the special education tab, on the classroom teacher notes, where before I just sort of do this blanketed message to everyone, being a little more strategic about what I'm asking and what I'm saying specifically to the parent. And that only happens through collaboration with the other program managers. And then the other thing that you were talking about, Adrian, oh geez, and now of course it's going to leave my head. If I remember it, I'll come back to it. But Renee, what tips would you have for managers?
Well, me being a health assistant, when I was in it for a year, they changed out our health manager. The one left, and so we brought in one that she worked here, but she didn't work under health. She had never done kitchen, and she was just like totally relying on what I had to do, and I'd only been doing it for a year. So, like you say, you definitely have to collaborate together. You have to, be able to listen to your health assistants, especially the ones, and not just health assistants, but the ones that's been here and has been through the good things and the bad, to listen to what their advice is, because that was the one thing that she did do. She was like, okay, and some of the things she took and some things we changed together, but definitely meet with us, listen to the health assistants. We did, like you were saying, with the family advocates. That was one of the things that was like, everybody had their own little team, and it was like at the beginning we didn't collaborate with each other, but then when we started doing that, and we actually meet with our family advocates once a month, to especially during getting ready to do enrollment or re-enrollment, we get with them and talk. And so once we started letting them understand how important it is to not just say that Head Start is school, that it's a classroom, I'm like, you got to be honest and tell them that, health is incorporated into it, special education, disabilities, all of that's involved. Then once the parents started understanding that it's not just going to school, it definitely helped. Our whole environment has changed because of that. but definitely as a health manager, talk and listen to your health assistants, because they definitely, like I said, if we've been around for a while, we've seen some things and know what works and what don't work.
Absolutely. And so, Adrian, I do remember the follow-up, which is actually for both you and Renee. You had said, Adrian, about making sure you have a plan to sort of tackle it, right? And it made me think of New Year's goals, right? We're just coming into this new year. And one of the things I heard was about not just saying I'm going to have a plan, but then doing action items of that. So if your goal is to do 3 competencies a month, and your goal isn't to just write down the word 3 competencies a month, it's to actually schedule it on your calendar every Friday for an hour, 1 competency, 3 weeks in a row. And so that's the way it sort of breaks it down into more manageable pieces. So in saying that, tell me, Renee, what specifically did you do to manage your time for your health essentials, or really any professional development that you do as a health assistant? What do you do to get through those courses?
I have a calendar on my desk that I keep there all the time, that I write down, and I will make it a priority. Like if I say it's going to be at 10 o'clock, I shut my door. I have this little slide on my door that says do not disturb. And I will make that a priority. And everyone knows that if that door's shut, that means I'm usually doing some type of training of some sort, because usually my door is always open. So, but I do that and make sure that I get it done in that certain amount of time. And I will say, when I was talking to Jackie, when I first started the health essentials, I did not realize that everything had to be done in a month. I thought it was just the webinar, not the actions, but not the class, the notes or whatever. What was it, Jackie? The
assignments.
I did not realize those had to be done in a month as well, because it didn't have a date. And I just totally forgot about the email that said you had a month. And so when I was like, oh no, because I was like, oh, I'm doing great. I got all those done and everything. And then Jackie's like, we need to do the assignments too within a month. I was like, okay, we're going to double up on that real quick then. But other than that, it went really well. But that is one of the things I do try to do, is just put it on a calendar. I put it on my Outlook calendar, so it comes up every day to remind myself to get it done.
And Jackie, can you give a description of one of the assignments from Health Essentials, if you recall?
Oh boy, put me on the spot there. There's one where it actually, the hygiene section, and it talks about the importance of hand washing, and you actually watch a video on it, and then there's some questions and you write a narrative on that. So just, I want to say pretty easy, because you're watching the video and you're just kind of giving a summary. One thing I thought of, though, as soon as I started talking earlier is, I talked a little bit about staff turnover and stuff, and the health essentials would be great for any new hires that are going to have to deal with health. I know when I came into the position, there hadn't been a health person there for months and months. So I had nobody to train me. I just had to kind of like jump in. I would wish this course had been there when I started. It would have been a lot less stress for me. So I highly recommend the Health Essentials for anybody that's going to work in health, disabilities, mental health. And then if your family workers are doing any kinds of screenings or helping families find medical homes or helping getting requirements, I highly suggest you have your family workers do the Health Essentials. It'll make their life so much easier. And it's very cost efficient, because when you actually add up the cost of how much new hire costs, when you bring together all the staff and paying your employees to drive there and all that, this is great, because you can just sign them up and say, okay, now you have, a month to do this. There's support online. Go for it.
Thank you. And then, Adrian, can you tell us something specific you did for certification to make sure you stayed on track?
One thing I did know, going back to something Renee said as well, and this will tie into yours, to your question, is we had to make certain that we had to work away from our work area, our workstations, because like you're saying, the phone is ringing all the time. You're constantly moving. You could be in your building, but however, you need to be away from your area. And we would meet usually at our central office as a group. And then we would go through the questions together just so we can try to encourage each other and to stay on task. Because as long as we're working in silos or we're working by ourselves and trying to complete, because some of those questions were a little, I don't want to use the word difficult, they were a little bit more intense. Some of the competencies required a little bit more than what you could just zip through. So being there with a group, someone else could answer the question that you may not be able to. And that I attribute to a lot to my old supervisor. She was the one that was kind of overseeing any of the questions we couldn't do. So just being organized and stepping away from my work area and allocating an hour or two on a Friday or just one day in the middle of the week so that we can get things done. And sad to say, sometimes it had to be on the weekends. It had to be, you had to put, an hour or so in there when you know that you're going to do that because you want to be successful. And you want to be able to complete the competency together. You don't want to be the only one that didn't complete it and everybody else. So you have to know right then, let me give an extra hour so that I could be on task with the rest of the group. So it did require just pushing forward and making certain that I stayed abreast of what was required and what we were working on that week.
Perfect. Thank you.
Mhm.
And then, yeah, go ahead, Jackie.
I wanted to, Adrian was in a special situation because they had such a large amount of people doing the certificate at one agency. But I would say the majority of the people completing the certification or essentials are not doing it with a group from their program. That's why the live Zooms that we have twice a month are so beneficial, because that's your group to ask questions and to share, and that's your kind of community and support for the courses. So I just wanted to kind of clarify that.
Perfect. Thank you for that clarification. And then I've been looking at the chat, trying to answer them as they come through. But now I'm going to open it up for the group. I believe you can unmute yourself to see if there are any questions for myself, Jackie, Adrian, or Renee. And if you don't feel comfortable unmuting, you can definitely put it in the chat as well.
I see we had a question about from Brenda, and she asked, is there a particular time to start health essentials? So each course has a cohort. So if you sign up in January for your health essentials, you're with a whole group that signed up to start in January. So the health essentials starts at the beginning of every month. And then for health certification, that goes 4 months. Again, that starts every month too. So if you started with the January group, you would be together for January, February, March, and April with your certification due the last day of April. So they are continually starting cohorts every month. You can sign up anytime during the month, but then you'll start at the beginning of the next month.
And it takes about, Jackie, would you say up to 2 months to grade, or no, it's graded as it's submitted, correct? But it still takes a little bit at the end after you submit for your final grade to come through for certification, correct?
Right. So usually you'll end up getting a couple days after you've your cohort has ended with our new system. Poor Adrian had to wait a little bit longer because she was on a different system. But no, you get them pretty quickly. It could take a week or two, but usually it's pretty quick.
And so let's talk a little bit about who the course is for and why you would take it. And we sort of sprinkled that out throughout it. But at the very beginning, we said, we asked the question in the poll of who's in the room, how many years of experience do you have? One of the things that we didn't ask is background experience, right? We all come here to this space with different background experience. So for example, for me, other than overseeing the health management for a fairly large Head Start program, I actually don't have a background in nursing or health, which my traveling nurse sister always thought was crazy, right? She's like, how do you not have this and you oversee it? And I always, because I was a larger program, I had health managers who had the background in health services. And one of the things that I would share with my sister is in Head Start, we have resources and funding for training. And so I'm able to go and get training for those gaps that I have. And whenever I first started Head Start, one of those gaps was Head Start in general, is there is nursing backgrounds, nursing degrees, and then there's sort of Head Start health and nutrition and food service and all, and mental health and all of those things that were just a little bit different, because it was more I had found about being able to build relationships with people, to be able to ask them these questions and to know more about well child checks and things like that. And so I would say, depending on your background, you'll probably find a course here at the Academy for you. So if you have more of a nursing certification, nursing background, you're going to find that probably that essentials and certification are going to give you this more sort of well-rounded look into health services, specifically from a Head Start perspective, because we're going to be tying this in to Head Start program performance standards. So for example, in Health Essentials, before it talks about dental and what you need to know there, it's going to say 1302.47. I don't really know if that's dental. Whoever knows what the dental one is off the top of their head, kudos to you, right? Like 1302.47. And then it's going to tell you about that Head Start program performance standard. And then it's going to tell you more about resources that you can use there. And so also I would say that if right now maybe you're on the outer limits of health and maybe you don't serve directly in the health services space, you might look at more of those basics courses that we didn't really talk about today, as well as eClick. And some of you in the chat, you put that in there, which I'm so glad to hear. There's so many times I would work with people who had been in Head Start for years. I call it eClick. I don't know what others call it. And we shouldn't use as many acronyms, right, Jackie? The Early Learning Knowledge, early, is that right? What is it? Early Learning Knowledge Center, eClick. And to make sure you're getting in there and using those resources. And what we've done in our courses is we went through all of the things that you see there, because it can sometimes be overwhelming. And we put it in a little package for you and said, here's the sort of top things you need to know as a Head Start leader, as a health manager, staff member, and you're able to look at that and parse out what you need to be able to complete your job. So I wanted to share a little bit about, is this course right for you? It really depends on what you're looking to receive out of a course. And if you're still not sure, you can also send me, and Courtney, if you can drop my email in the chat. Courtney is our NHSA producer today, by the way. If you can put my email me and we can talk through it, and as well as I can give you a look at one of our courses. And so that way you can see what it looks like, what it feels like, and what the course is like as well. Okay, so let me see if there's any other questions. Okay.
Christina, I saw a couple on like cost and things like that. Every year we do a professional development plan, and this is an awesome thing to put on there. And I believe you guys put on there, you have a letter for people that they can use to submit to their supervisor, asking if they can take this as part of their professional development, kind of outlining everything. And I think it's always good to remember that everybody does have a TNTA budget. And this is an excellent use of those funds.
Absolutely. Thank you for that. Okay, well, I don't think there are any other questions in the chat. For those of you here today, and if anyone else at your program signed up and they're not able to make it, we'll be sending out information as well as the recording and the slide deck. So you don't have to worry about that. I also want to take this time to say thank you to Jackie, Adrian, and Renee for coming on and talking with us today about their experience as an instructor and also a learner in the program. And then finally, I want to thank all of you and all of these squares today. Your time is very valuable, and I appreciate you coming and learning more about NHSA's the Academy professional development, but more importantly, I hope that you understand the overall need and importance of professional development for you wherever you receive it from, and that if you ever need any support from NHSA, we are here for you. We love getting on a Zoom call and chatting, even if it's not about professional development and you have a question about health in general. We're a community of learners, and that's what I said at the beginning of this call, is to be able to network with each other, see some friendly faces, and to be able to say, I know Adrian, I can shoot her an email and say, okay, lady with 2,000 children in her program, let me ask you this question. Or Renee, as an assistant, please tell me what's going on in your community, in your program. We are here for you. And I just wanted to say thank you for making the time to come to our meeting today. And everyone enjoy the rest of your Monday and have a great week. Thanks, everyone.